Professor Wang, thank you very much for taking the time out of your morning to join us. So the latest Chinese state media confirming 25 deaths, and that's up from 18 last night. How urgent and concerning is the situation? Understanding, of course, that how China has dealt with previous viruses like SARS, and now knowing that the authorities, of course, have locked down 8 cities in Hubei province, affecting millions of people.
Yeah, so 18 deaths to 25 deaths, that certainly is concern. But I think we still have to put things in perspective, right? 25 deaths in winter in China, in a city like Wuhan. I think compared with other flu and things like that, I personally think that, certainly we need to pay close attention, but definitely no need for panic.
Right. So what would the number need to be in terms of, I don't know, deaths or infections for the World Health Organization to reassess, their conclusions to whether or not to call this a global public health emergency?
Yeah, that I think is one important consideration. And usually we sort of measure this by the case mortality. So how many people got infected and how many people get severe or death. So I gave you a number. For SARS, it's 10%. And for the 3 related coronavirus recently, SARS is the first. The mortality was 10%. And then for the Middle East respiratory syndrome, MERS, the mortality was 35%. And for this one, because the number is not in, it's hard to estimate accurately, but most scientists thinking it's between 0.1 to 1%.
But the problem is here, when you look at the emergences of these viruses, of course, they adapt and they mutate. And in the early days, perhaps the casualties may not be as high in terms of the number, but then later on they can develop depending on how infectious and lethal they are. Should the WHO sort of look at this issue more as a sort of precautionary preventative measure just in case this could mutate and adapt into something more serious?
Of course, this has been debated for 2 nights, and I was actually on the committee. And so one thing I think that you have to satisfy 3 criteria to declare a global sort of public health emergency. One is actually internationally. So right now, I would say that certainly within China, in Hubei province, that all conditions have been satisfied. But internationally, for example, Singapore, we just had the first imported case. But if we don't have local community transmission, then I think that's why WHO is still kind of considering that might be still too early to call a global emergency. Definitely a Hubei province emergency.
Right. Look, China, of course, held that important media briefing on Wednesday, the China National Health Commission, and they said that, they're increasing transparency and communications with international organizations such as the WHO, and they're pouring an incredible amount of resources into sort of studying and understanding the origins of this virus and also potentially to come up with vaccines for it. How quickly and how successfully can that happen in terms of coming up with the vaccinations when these things constantly evolve and develop?
I saw it on the program. You just had the CEO of CEPI, who was in Singapore just last month. So this is a new organization. So not only the Chinese are working on this, there's a whole international community working on this. If you want to develop a totally new vaccine, I think this takes a long time. But nowadays, we have this platform called a uniform platform so that they actually can plug and play, almost like plug and play. So some people is predicting that we may have vaccine candidate in clinical trials in 3 months.
Right. And Dr. Wang, looking at previous occasions when the World Health Organization declared an international public health emergency, we have to sort of rewind all the way back to, of course, the swine flu. What parallels can we draw from that experience and the coronavirus? Of course, understanding that the numbers are vastly different here.
Yeah. So that's interesting. The WHO has to be cautious because that one was declared as a global sort of public health emergency. But in retrospect, they also get criticized as being overreacting because initially the spread was very rapid. But again, just like this case right now, the mortality actually was not high. So some people actually criticize them for reacting too early.
Dr. Wang, Professor Wang, I want to get your thoughts on this. And someone asked me this the other day, in fact, as the Wuhan virus is getting worse and worse. And someone asked me and said, Have you ever thought about why is China, a source of a lot of these superbugs? You have to look at SARS, in a way, bird flu, and now the
Yeah,
coronavirus. And then history takes us all the way back 600 plus years when millions were wiped out
yeah,
in populations because of bubonic plague. Is it because
yeah.
of the country being too populous? Because we don't really see these superbugs coming out of India.
Oh, this is kind of difficult to judge because India had an outbreak of Nipah virus. And I think it can be maybe contribute to three: populous and also diverse, animal and kingdom. So you have more animals, you have more reservoirs. And then there's one important is the tradition, right? In China, many different places, they just like a live animal sort of trading and food, So that's, I think, obviously like this one, just like SARS, all originate from live animal market.
Are these viruses, you think, going to become a whole lot more frequent and virulent? And what does it say about the issue of overpopulation in the world today and about humans' living habits?
Oh, without any doubt, I'd say, viruses have been existing for millions and million years. And it's really the intensity of farming and also the rapid transportation that all contributes to increased emergence of new viruses.
And looking at, of course, the strategies that the various countries are putting in place in order to contain or at least not allow these viruses to hit, countries like here in Singapore. I mean, you just talked about Singapore getting our first case here. Singapore, the fact that Singapore has been through this before with SARS many, many years ago, does that put countries like Singapore in a more advantageous position because they understand how vulnerable, they can be when we have a spread of these superbugs?
Without any doubt, I think, I might be biased. I think Singapore is among the best prepared countries. We have learned from SARS. And also we have really worked, the scientists and clinicians are working much closer. And also we have facilities built, really to respond to this. And for example, the program that I'm the director of, Emerging Infectious Disease Program at Duke-NUS Medical School, was built in response to events like SARS.
All right. Professor Wang, we covered this story a couple of days ago in The Guardian, talking about the lack of antibiotics. I mean, it's separate from, of course, viruses because they deal with bacteria, and saying these drug companies are resistant to coming up with new antibiotics because they just aren't profitable enough. What does that say about sort of the evolution of vaccinations to combat whether bacteria or viruses that are hitting the human population around the world? I mean, are we in danger of not producing vaccines fast enough to combat all of this?
I sort of beg to disagree on this comment of say, a company trying not to produce antibiotics because they don't make money. Same with the vaccine development. I think the vaccine development, nowadays has much higher stringency and the company takes much longer. That's why I think, and especially for these kind of emerging deadly viruses, it's really not suitable for the classical model of producing it through commercial companies. That's why I think a government, international organization like the CEPI, I think is going to be much more effective.
Earlier you talked about what are the normal rates of people, sort of getting infected by the flu and the fatalities there. And you're saying it's rather seasonal. So at what point should authorities in China get a bit more worried?
For this one, I think the Chinese authority or the Singapore authority, I think is equal, that we will get much more worried if we have community spread at the scale like in Wuhan. I really have to emphasize, I could not emphasize more, because in Wuhan, in the early days, the spread has happened without the detection because at that time, the test was not ready. And also the government made a public statement, said there was no evidence of significant human-to-human transmission. As soon as the government and WHO declared that this virus is capable of human-to-human transmission, I think the whole world and the whole sort of society, in each city now is on highest alert, just like we are doing in Singapore. So I'm hopeful that the transmission will be controlled. That other than Wuhan, that's too late. That's why the government basically quarantined the whole city. But in places like Singapore, in places like Thailand, Thailand had 2 cases a long time ago, a few weeks, now 2 weeks, and then remain to be on that number. So I'm still hopeful that we will not have a widespread local community transmission.
Yes, let's hope not, Professor Wang. But I mean, I just want to get to the issue of human-to-human transfer and, of course, the risks that the healthcare workers face, and particularly so in Hubei province, in those hospitals where some of the patients are, because we know that medical workers are getting infected despite the use of medical gloves. Masks. So, what precautions should we be taking in order to, stem the outbreak here?
Well, I think it's really now it's a whole kind of a society effort now. I mean, from government, from medical staff, from scientists like myself, but every citizen as well, because I think that in theory, the risk is in the society, especially places like Wuhan. In Singapore, I think the risk in the society is still low. So what we need to do is really look out for all the risks and try to definitely avoid public places with a lot of people if you can, and wash hands. That's very simple thing. The other thing is, I think really for citizens, that if you feel uncomfortable and have fever, you really should avoid contact and seek medical attention and test as soon as possible. I think that's the most effective way to prevent future community spread.